So the webinar for this month, as those of you who have been following us, we started to do a monthly webinar. And our first webinar, if you haven't seen it yet, was more of an introduction of the product, what's in the packaging, and how to use the app. Last podcast or webinar was about knee strength and testing knee strength into flexion and extension. And today, the topic of the webinar is foundations of strength testing. And we're going to focus on the shoulder today, but in three specific motions. So last time we used the knee, and as you know, the knee only has two motions and it took up the majority of our time. So today, instead of doing all of the shoulder, we wanted to break out May and June's webinar into three different motions for each. And so today we chose shoulder flexion, abduction, and external rotation because we felt like those three had the most correlation between those directions, or when someone's injured, those are usually the directions that are most affected. And then next time we'll go into internal rotation, abduction, and shoulder extension. And we'll release pretty here shortly the dates and times for that. So to introduce speakers today, as you know, if you've attended previous webinars, my name is Daniel. I'm a PT based out of Salt Lake City, and kind of my involvement with ActivForce started a couple of years ago, I think in 2020, where I graduated college, my schooling in 2019, and I realized that manual muscle testing was extremely limited when it comes to objectivity to our patients, right? I wanted to find a tool that allowed my patients to understand why they were weak, why we were doing the exercises, and that I could track their progress from visit to visit so that they could see actual progress, right? I think a lot of times as PTs, we focus on pain and we focus on range of motion because there's actual numbers that we can get to. But then once we got to more of the strength portion of care, usually we just had to rely on someone feeling stronger, right? Or them being able to do more weights depending on what kind of setting you're in. And so I reached out to ActivForce, and we developed a relationship to the point where I helped build and design the ActivForce 2. And now we sell the ActivForce 2 globally. The goal is obviously to change the physical therapy profession to where manual muscle testing is still, I think, good in some situations, but that we move towards more objective testing when we're treating patients. So that's a little background on me. I want to introduce Dr. Erson. Dr. E, do you want to introduce kind of your background and yourself?
Sure. I go by Dr. E online, but you guys can call me Erson if you ever meet me in person. I've been a physical therapy influencer for probably about 12, 13 years. I was one of the originals in the space. You can find any of my work if you Google my name or at Modern Manual Therapy on Facebook, Instagram, and YouTube. I also have a big LinkedIn community. I teach online and live seminars under the Eclectic Approach and Modern Manual Therapy brand. And I love the ActivForce and I sell the ActivForce. It's one of my top sellers on my e-commerce store for PTs and rehab pros and fitness nuts. And that's called Edge Mobility System. But I've been a PT. I'm cash-based currently out of Buffalo, New York. Been a PT for 26 years. I've been anything from a private practice owner to manual therapy mentor, PT instructor in 3 PT schools. I also have a podcast, Untold Physio Stories. So lots of stuff. If you Google me, the first I don't know, 100 hits will probably be all my web pages. Maybe 101 will be my dad, but that's quick on me.
Awesome. And why do you love the ActivForce so much?
Well, I mean, it's crazy that I think someone like you, it took until like 2019, 2020 for someone to say, hey, we need to be more objective with this. I mean, I've always said that like manual muscle testing is the most, we're trying to be so evidence-based and so objective in our objective measures, and it's the most objective measure that we have. We
Yeah.
basically, what do we learn in school? Hey, Daniel, you're testing Erson, who is athletic and pretty strong and fit, versus you're testing Mrs. Jones. So her 5 out of 5 is different than his 5 out of 5. So you kind of like manually measure someone internally, like, well, I'm going to test Mrs. Jones for a 5 out of 5, but it's obviously going to be different than testing Erson versus a power lifter versus a CrossFitter versus someone who just had shoulder surgery, you know, and you're still making this objective measure, and it's also meaningless to patients. It's one of the things that I even like to say when I promote ActivForce is no one ever got excited when I was like, hey, Daniel, last time you were a 4 out of 5 and now you're a 4 plus. I mean, like, good job. It's totally meaningless to patients, right? But I've had patients get excited about their progress, get excited about doing strength measurements, even just like seeing, well, like, wow, I didn't even realize, especially someone who's athletic, I didn't even realize there was like a 15% difference in my shoulder external rotation, my hip abduction, because obviously they're strong and fit, but it's
Yeah.
very motivating to see the graph, to see that average force, the peak force, and especially that percentage peak force. People are shocked often that they have, greater than 10% deficits.
Awesome. Awesome. Love it. Well, kind of following that train, I think we introduced really briefly, what we're talking about today. And so the agenda for today is we'll go over a study on the ActivForce and the microfet that was done to test the reliability and validity of the two devices, right? And then what we'll do is we'll go into a little bit of anatomy of each shoulder motion, along with how we test it using the strap and using just the hand strap. So we just putting on your hand versus tying it down to something that doesn't move. And then Dr. E or Erson will go into a case study on a patient that he usually sees on a regular basis, and then go over rehab interventions for that case study. So again, if you have any questions at all following, throughout the webinar, please drop them below so that we can look at the questions and be able to answer those questions for you at the end. Okay, so this was a study that was done that was released in the IJSPT. Now, this is an observational study, and there was 29 participants, so still maybe a little bit lower than a randomized controlled trial. But what they did is they took 29 healthy adults, and they each were assessed twice by 3 testers. 2 of those testers were experienced clinicians, and 1 was a novice PT. And they tested shoulder external rotation, internal rotation, and obviously forward flexion, using both the ActivForce and the microfet too. And so when they tested at different angles, right? Forward elevation was tested at 45 degrees at the scapular plane, or some would call it scaption. And what they found here at the bottom is that both the ActivForce and the microfet 2 handheld anemometers were found to be highly reliable across all shoulder motions, regardless of tester experience. Right. And one thing I want to highlight here is we get a lot of questions about validity and reliability. And one of the things that I usually tell people is that remember that the technology behind, the ActivForce or all of these handheld anemometers is really just force plates, right? It's a force scale. So it's the same technology that you would use when you stepped on a scale at home, right? Or you put your bag when you're at the airport on the scale. And so what it comes down to is if you want to be accurate and valid, is making sure that the device doesn't move during testing and that you're testing the exact same way with every single test, right? So it's more the tester that may provide a little bit of error in the measurements is as long as they're testing and not keeping the device still. And so here with what this I think shows, and what I think is really cool about this study, is it shows that even novice PTs, who are educated on kind of the principles of how to keep the device still and when to have them push against a wall or push against a inanimate object, you can still get accurate measurements no matter how long you've been practicing, as long as you follow those two rules, which again are keeping the device still and making sure that you're consistent in the ways that you test.